Tonight, Democrats are seizing on a comment from Darline Graham, the sister of the late Lindsey Graham and the Republican senator from South Carolina. She appeared to make the case for government getting involved in health care right after trashing that idea. Listen.
Gun control, government-run health care, abortion until the moment of birth, bad idea after bad idea. Annie Andrews backs them all. I grew up in the back of a bar and liquor store in one room in central South Carolina. My parents worked long, hard hours to make ends meet. We didn't take vacations. If they were sick, they had to get up and go to work because the doors weren't open, we weren't making money. My mother passed away when I was 11 and my father just over a year later.
Her opponent, Dr. Annie Andrews, took issue with that. She joined CNN earlier today.
What is so radical about thinking every county in South Carolina should have an OBGYN? What is so radical about thinking if you're sick, you should be able to afford to see the doctor? So what she said there was that her healthcare plan is you should work hard until you die. I'm a physician who's worked on the front lines of America's broken healthcare system for 20 years, taking care of South Carolina's sick and injured children. I believe that we deserve better. I believe that Darlene's parents deserved better. I believe that healthcare is a human right, that we must shift America's profit-motivated healthcare system to a patient-centered healthcare system that actually meets the needs of everyone in this country.
So it's interesting because in a Republican primary, Paul, that it makes sense that she would say that, but it's kind of T-ball for a Democratic candidate because you're sort of putting right on her, in her lap this idea that, I mean, the tragedy of Darline Graham's parents dying at such young ages is exactly why people feel like the healthcare system is broken.
And I'm sure she wouldn't wish that on anybody. Okay, I don't know her, but I don't think she's. But she sure said it, right? She sure said work until you die, essentially. It reminds me of Joni Ernst, whose career ended as a senator from Iowa when she said, well, we're all going to die. When somebody said you cut Medicare, you cut Medicaid, people will die. I guess first, bless her heart, you know, as a fellow Southerner.
You can't take
but that's Bakari's. I got to let him. But there is a poll out today. There's a poll out today from Andrew's campaign, okay? And it shows it tied. So I went, look, the poll was done by Impact Strategies, who we know. This is John Anzalone, Jeff List, Zach McCurry,
This is
Molly
a Democratic-leaning.
Democrat, but I would rely on them. I wouldn't do that. I wouldn't tell you that of every pollster I know.
Right.
Not like media strategy.
Just so that people,
Karen Bass is up like 10,000 points right now in Los Angeles.
So that people understand that is a partisan poll, which we don't necessarily do here at CNN.
Right, but I do because I know that firm. I would rely on.
Yeah.
Okay, you 100% should rely on it, and I think you should funnel as much money as humanly possible into South Carolina tonight, because Graham is clearly going to lose this if you just spend a little bit more money. She's not going to lose, and this idea that South Carolina is going to go to a Democrat, same like last night, Arkansas going to that, it's just not going to happen, which is a missed opportunity, I do think, actually, for Democrats. If you want to really take advantage of this, you're not going to spend money and put attention into states that you know you're not going to win. That is wish casting.
Jason, I mean, on the substantive issue that is raised by her comments, when you tell Americans, just work until you die.
That's not what she told Americans. That's not actually what she told Americans.
Well, what do you think about the message that she was sending to Americans?
Yeah, the message that she was saying was so this is something different between, I'm guessing, the South and everybody else, especially folks on the coast, where we work really hard, we are working all day, we're not complaining and asking for free things all the time. That was what she was trying to do. It's the equivalent of that. There are a bunch of memes where you show like one misplaced comma, and it sends a completely different message because of where that comma was. That needed a little bit of a bridge. She needs a better speechwriter, because what she was saying was, here's who I am, here's who I am not, here who she is. She was clearly not saying
she was reading
that this was her.
It was charming when she was selected to succeed her brother after he passed. I thought that was charming. I thought the president endorsing her and fighting for her against the odds was also brave on the president's part. But these remarks come off as cruel, and I don't care how you spin it, This is just
Go on
awful, awful. This is worse than her not knowing where Taiwan.
Now, I'm sorry. I think, and you can play this well. I do think that this is a reasonable thing if you're a Democrat to go after her. But also
I'm not a
looking at,
Democrat.
I'm saying in the general sense, but looking how some folks on X are approaching it, they're mocking her, and that risks some significant.
We don't want to dumb the conversation down to what people are saying on X.
what
I'm talking about, just a quick data point for you. What I'm talking about is 64% of Americans in an April poll said that they are worried about affording health care costs. Health care costs are contributing to 530,000 personal bankruptcy filings every year. That's approximately 2/3 of personal bankruptcies in the United States that are related to medical expenses or illness-related loss of work. So again, healthcare actually has not been a great issue for Republicans. And I know that single payer is seemingly a good battlefield to fight on, but generally the American people are trending away from the system as it exists right now.
Well, the first thing is Republicans have not had an alternate plan, a plan of any substance to Obamacare. We've been talking about it. They have had this fundamental inability to put up anything to fix the healthcare system in this country. That's first. Second, Darline Graham, it is kind of bless your heart. I mean, she's fumbled through. She's inexperienced. There's no qualification she has to be a United States senator. Yes, her comments were inartful. But when you combine that inartfulness, and shout out to Lindsey Graham's staff, because they took someone who has no qualifications to be a United States senator, and they nimbly navigated that race with Trump and everything else and won. So shout out to them. But in South Carolina, you literally have counties where you don't have an OBGYN. Wow. So imagine women trying to get health care and they have to drive 50, 60, 70 miles to their nearest OBGYN. We have rural hospitals that have shut down. So if you have a heart attack in the rural communities, that's a death sentence. So these are real issues. And so when you combine it, whether or not she needed a comma here or there, but the messaging of Annie Andrews saying, look, she's saying work till you die. I'm saying no, provide better health care. This isn't a Medicare for all conversation. Mm-hmm. This isn't a New York or LA conversation. Mm-hmm. This is a conversation that hits every single door, black, white, Democrat, MAGA, in not just South Carolina, but Arkansas, Mississippi, Georgia, all these rural communities, and it hits them and it hits them.
Well, here's why it hits them. If you take a look at this, this is United Health Foundation's annual health rankings. The best states to be healthy in this country are blue states. If you look at this chart, South Carolina is at 36th out of 50 states, and that's actually an improvement on where they've been. And the bottom of the list is overwhelmingly dominated by Republican-led states. Again, healthcare seems to me to be, if I were a Republican, it's probably the last thing I would talk about.
Well, I've always said I'll give somebody $20 right now if they can give me the Republican position on healthcare in 10 seconds or less.
It'll be here in 2 weeks.
Okay.
They don't have one.
So the problem is that government-run health care isn't the solution. We already have that in our country. It's called the VA. If you have any veterans in your life, go ask them how much they love that. They'll tell you that they get an appointment and 6 months later they commit suicide before they even get to the appointment. That current system only handles, it's still not great. We could do better. We should do better as a nation.
Yeah.
It's bad under every president, not because of the president running it, but because the system of government health care is never going to work. That system only services 7 million people. Imagine then if we extrapolated it out to 350 million people. That's not going to work. Young people, Obamacare, sure, expanded coverage for them, but it also made their health care way more expensive. You know why? Because it put an artificial subsidy in the market that said, guess what? Young people are now going to subsidize health care for the old. Well, in our current country, the old are who predominantly is sick and unhealthy. So government-run health care via Obamacare ain't the solution either. But Republicans got to get it together, because I think in 2028, health care is going to be a big issue. And I felt that way when we saw the killing of the United Healthcare CEO with Luigi Mangione, and the public sided with him. That's how much resentment is there, and it's not misplaced. And the answer can't be savings accounts.
Excuse me. I said that it was cruel of her. It sounded very cruel of her. But why, if it's so cruel, why do so many southern states abide by that? We're in it on your own. You're in it. You got to save your own self.
It's a good question.
You got something broken. You got to save your own.
Did you
self.
see the results of that?
I see the results of it. But
I think what's also
what's
interesting.
going on?
I think
there are Americans just
two pieces of context. I mean, I looked this up before we came on the air. Obamacare is still more popular than it is unpopular.
Correct.
And when you looked at the places where Medicaid expansion exploded in the last several years, guess what? A lot of those states were in the South because they know they have a healthcare problem and people need more healthcare. And when they had access to more, they took it. So I don't know that this is that chart that you're seeing there and the resistance among Republican leaders in the South to come up with real solutions on healthcare. I don't know that that's because voters don't want it.
But
I think
Obamacare is not government-run healthcare.
Well, I didn't say that it was. Yeah.
And it's also not just young people having access to health insurance, which of course is a good thing.
No,
but
it also talks about
making sure that you can avoid. It also
made it so that the young subsidize the old. That's unfair.
It also talks about the fact that now you can get.
Hold on,
It also talks about the fact that now you can have preventive care, right? It also talks about the fact Obamacare has done so much, and when you expanded Medicaid in these states, which Obamacare provided for, you were actually able to keep these rural hospitals open so people had access to that quality care. And so it's somewhat of a point of it's somewhat of a point of a point of privilege when you're having a conversation.
Hold on, Caroline, just a second.
It's not a word per minute show. It's also very interesting when you have a point of privilege when you grow up and you have access to that care. And we're talking about South Carolina, Mississippi, Alabama, these poor states where they do not. And so what Obamacare did was not just come in and do these raising limits here, but it gave people access to quality care, which a lot of people believe is.
Oh, right. I remember.
Go ahead and respond.
If you like your health care, you can keep it, was one of the biggest lies ever told in politics. And you haven't answered my question. You are okay with the government telling young people that they need to subsidize the care of the old artificially for no other reason that the government says so. That's okay with you.
But that's not true.
That's what it did.
That's not true.
Exactly what it did.
Effectively what
That's not effectively what it is.
That's
absolutely
where young people are punished
Obamacare didn't just shift the burden.
Who's
How about
paying
this?
for it?
How about this?
And young people right now are who's most upset about the cost of health care.
Do people deserve access to quality care? Yes or no?
Because we kind of already have.
Do people deserve access to
Medicare is essentially government-run health care.
I think you're conflating quality health care and insurance.
And then Jason, I want you to respond.
Just do people... because you have to have access to it. This is a conversation about access. The privilege that I'm talking about is if you have access
on the backs of young people.
Oh my goodness gracious.
Hold on.
Is if you have access to care, it's easy to sit on shows like this and articulate points about this, that, and the third. And all I'm simply saying is that we have unhealthy communities growing up in food deserts, growing up in environmental unjust communities, et cetera, et cetera. But when you also eliminate access to care, it has... The stats are right there.
Okay.
Red states are the ones where you have poor health outcomes.
Well, poor states are the ones that have the poorest.
And they're also red.
But I saw Wisconsin on that list.
Yeah, and look, I mean, there are states like California and New York are right in the middle, and yet they are bringing in the most revenue into these states.
Louisiana, Mississippi, Alabama, Arkansas,
Utah,
South
kudos
Carolina.
to you for being number 5, a red state. But I do think that, part of the Republican plan, or at least right now under the Trump administration, a lot of things RFK Jr. is trying to do is just getting laughed at of the room. I mean, he's doing things that will be transformative as it relates to preventative care. To your point, and I think it's incredibly important. We're removing food dyes that are deeply unhealthy out of the food supply.
No, hold on.
We are giving prices. The prices of medication is going down.
Dyes
yes, it's a huge thing.
No, it's actually not.
It is a huge
listen,
thing.
I think it's an important thing for people for whom that is very important to them. I think that's...
It's about health.
Yeah, but it's not going to stop someone from dying from a heart attack, okay?
Correct,
the things that are
but
killing,
it helps you
the
cut
things that
down
are
on
killing
obesity,
Americans...
which does lead to heart attacks.
The things that are... Hold on. There's no evidence that food dyes are causing obesity.
No. Oh,
so,
okay.
And there's also no evidence...
And
hold on, let me just be clear about this. There's no evidence in humans that food dyes even leads to the things that they're concerned about, which is our behavioral problems. Those are in rat studies. It's concerning, but it's not actually in human studies.
The whole point,
we know what is killing Americans, and it is not food dyes. Okay,
is part of it obesity? Is obesity leading to a lot of heart failure issues? And are we
food
pushing,
dyes are not,
respectfully, we're pushing people into healthier food option choices.
I just want you to be factual about this stuff, because because the issue with obesity and what causes it is not food dyes. That is not
I'm not saying it's only, respectfully, I didn't say it was only food dyes.
I'm just
and you know I didn't just say that.
Yeah.
I'm talking,
Look,
I'm giving you
it's not
examples.
food dyes, okay?
Is it true that eating whole
let's
foods,
encourage
healthy foods that are
kids-
not filled with chemicals,
Let's encourage
is it healthier or not?
kids
It
to
is. It's
get
also more expensive.
vaccinated so that they
No,
don't get
I
measles
agree.
and die. And let's also encourage
Didn't
them
say
to
that.
eat healthy foods, which Michelle Obama asked the country to consider
And then
more
she
than a
gave
decade
unhealthy
ago.
foods
And she
to
was
left.
And
laughing
so
And she was laughed
all
at
of
because it
those
wasn't
things I
actually
think
healthy.
are good ideas.
It wasn't.
Well, big
But
sugar
she
can't
tried, but it wasn't
even
successful.
with all of those things, we still need health care. All right,
No
next
one's
for
arguing
us,
against that.
a new report